topic for today is typical vertebra. A typical vertebra is a term that we use to describe the basic structure of each vertebra. Just like a building has a basic structure for its rooms but have different interior designs, similarly all the vertebrae of the vertebral column, they have a basic structure that is common among all the vertebrae. As you can see here on the table, there are different regional vertebrae and they have a common basic template. So today I'll be using a typical thoracic vertebra to describe the typical vertebra. Typical vertebra. On the anterior side, we have the vertebral body. This is the vertebral body that is present on the anterior side, and on the posterior side, we have a vertebral arc. This is a vertebral arc that is present on the posterior side, and on the anterior side is a vertebral body. The body is the weight-bearing part of the vertebra, and it increases in size from cervical region to the lumbar region. These bodies are attached to other vertebral bodies through intervertebral discs. This is the superior view of the vertebra, and this is the inferior view of the vertebra. So on the inferior side as well as on the superior side, there are intervertebral discs that connect them to other vertebra. For instance, as you can see here, these are the vertebral bodies on the anterior side, and they are connected through this intervertebral disc. These discs, they absorb shocks. Moving on, posterior to the body, we have two bony pillars. These are two bony pillars of the vertebra and are known as pedicles. They are the pedicles that project posteriorly to the body, and they attach the arc, the vertebral arc, to the body. Posterior to the pedicles, we have two sheets of laminae. These are lamina. Together they are called as laminae, and they project posteriorly from the pedicles and they meet at the midline. Now here at the midline, they form the roof of the vertebral arc. They form roof of the vertebral arc, and posterior to the laminae, posterior and inferiorly, a spinous process projects from the junction of the laminae. This is a spinous process, and it acts as a site for muscle and ligament attachments right here. Now again, from the junction of the lamina and the pedicles, we have transverse processes that project laterally from the junction of the pedicle and the lamina. As you can see here, these are the transverse processes right here. They project posteriorly and laterally from the junction of lamina and the pedicle, the lamina and the pedicle, and from the junction laterally, they originate as transverse processes. They act as site of articulation for ribs in the thoracic region. As you can see, these two projections here, these are the superior articular processes. They also project from the junction of pedicles and the lamina. They also project from the junction of pedicles and lamina, and they project superiorly to attach with the inferior articular processes of the vertebra above. I'll show you on the inferior side as well. We have superior articular processes and inferior articular processes right here. The superior articular process and the inferior articular process, they originate from the junction where the pedicles meet the lamina, and they help in articulation with the vertebrae above and below. The superior articular processes, they face outwards. They face outwards and are flat, whereas the inferior articular processes, they face inwards. They're facing inwards, whereas the superior articular processes are facing outwards. In a second, I'll show you how these articular processes connect with the vertebra above and below. So these are their two thoracic vertebrae. We'll identify the superior articular processes again. These are the superior articular processes. Similarly, here we have superior articular processes. On the inferior side as well, you can see these are the inferior articular process. As described earlier, the superior articular processes will articulate with the inferior articular process of the vertebra above. These are the inferior articular process of the upper vertebra, and they will connect with the superior articular process of the vertebra below, and hence they will form the joint. So these two vertebrae, they are connected through their articular processes, and that's how they connect. So this was the superior articular process, and this is the inferior articular process, and that's how they connect. When they're connected, you can see here that the articular processes have been connected. This is the superior articular process and this is the inferior articular process, and they have formed an intervertebral foramina. This is the intervertebral foramina, and this is the site where the spinal nerves, they exit the vertebral canal. Now this is the vertebral foramen. This vertebral foramen, when they are connected together with other foramen, they form the vertebral canal. These vertebral foramen together, they form the vertebral canal, and it is a passage for the spinal cord and the meninges of the spinal cord.